It's got to work first.
Hello, I'm Dr. Gwen Rees. I am a vet and I'm currently the lead on the Arwain Vet Cymru project working at Bristol Vet School. And I was asked to talk to you just very quickly today about the Arwain Vet Cymru project. You may have heard of it, you may not, but it's something that you can ask your vets about. And essentially it is a new programme looking at promoting responsible veterinary prescribing and antimicrobial stewardship in Wales. So a little bit of background on the project. The TB delivery partners, so Iechyd Da in South Wales and Míl Feddygon Gogledd Cymru in North Wales, set up a responsible antimicrobial use working group and began benchmarking veterinary practices on their antibiotic purchasing back in 2016. And around the same time, the Welsh Government, who have an animal health and welfare framework group, set up an antimicrobial resistance delivery group. They then published a 5-year antimicrobial resistance plan last year. And 2 of the points of this plan were about improving standards of antibiotic selection and prescribing in animal health and improving standards of antibiotic supply. So we, as a collaboration, got together and designed this project aimed at addressing those 2 points in the 5-year plan. We've got Rural Development Programme funding through the Welsh Government until summer 2021. So the project, it's a true collaboration, which is great. So we've got Iechyd Da, Míl Feddygon Gogledd Cymru. Of those, we have Rob Smith, Ivan Lloyd, Paul Rogers and Dewi Hughes directly involved in the project. We have the University of Bristol, more specifically me for the University of Bristol. I work at the vet school and I'm leading up on the Vet Champions part of this project. And we at the University of Bristol have quite a long history of working on antibiotic resistance projects. We've won some Antibiotic Guardian Awards, and this is really our area of expertise. And we're also working with Welsh lamb and beef producers, namely Don Thomas and Iestyn Jones, who some of you may know. So the project outline, it's largely split across the collaborators. So Iechyd Da are taking the veterinary practice antibiotic and prescription purchasing data that they took in 2016, and they are going to be running that again for every year from 2016 up until now to see what it is that veterinary practices are using, what antibiotics they're buying, and we hope that that'll give us a picture of what they're also selling. So they're looking at the benchmarking side of things. University of Bristol, so my role and what I'll talk a little bit about is to train and support a network of veterinary prescribing champions across Wales, and I'm doing some research around that as well. And Welsh lamb and beef producers are working on an on-farm medicine use data capture system, which some of you may be aware of, but they will be rolling out in the next few months. With the veterinary prescribing champions, which is my area, the plan is to develop a national, so pan-Wales collaborative network of really highly motivated and trained vets. So we've invited 1 vet from every practice in Wales who do any farm or mixed practice work, and we're inviting them to become the responsible prescribing champion for their practice and their practice's prescribing lead. So essentially they will be the ones who make prescribing decisions on behalf of their practice from that point onwards. We've asked them to attend a training programme and a series of workshops, and the aim of all of that is to develop and implement at least 1 bespoke antimicrobial stewardship interventions to make a big change in their prescribing in 2021 based on the training and the workshops that we run at the moment. We're really looking at sort of stimulating behaviour change amongst vets and therefore amongst everyone using veterinary sort of prescription medicines, really. And then part of the research is measuring the impact and the legacy of this project. So who are the champions? We have 17 vets from 15 practices across North Wales and 26 vets from 25 practices across South Wales. That represents over 80% of the practices doing any farm animal work at all in Wales, and they are all of the big players really. So we're really, really pleased with how well this has been taken up by the profession and how keen everyone has been to join the programme. Everyone, you can see from that pie chart, so that's looking at the interests of the different vets involved, and it's really neatly split actually. So we've got vets who are interested in dairy, beef, sheep, mixed practice and smallholders in about an even mix, which is lovely. And most of our prescribing champions are either the partner or the clinical director, and most of them are graduated over 10 years as well. So we've got a real wealth of experience and quite a lot of seniority, so they're going to be able to make the decisions that they need to for their practice. I won't go into this in too much detail, but the training programme that these vets are then undertaking has been put together and is coming from a real range of experts in the field. So these vets are really lucky, really. They're getting a lot of training as part of this programme, and they will be very, very highly trained in responsible veterinary medicine use and in antibiotic use. And we've had the Chief Veterinary Officer of Wales, Christian Glossop, for example. We've had various experts from various different universities, including Professor Daryl Abernethy, who's the new head of vet school at Aberystwyth, talking to them as well. After the series of training webinars from those experts, we are interspersing them with live discussion groups, which are split into the North Wales vets and the South Wales vets, and these are being facilitated and trying to really get to the heart of any problems that the vets might see when it comes to prescribing and what the challenges and what the sort of benefits of making these changes might be. We'll then be hosting a workshop in World Antimicrobial Awareness Week, which is mid-November, looking at each veterinary practice designing their own stewardship intervention, which they'll implement in January 2021. There will then be several further workshops running through 2021 for these vets. So one on looking at informing Welsh Government on policy, and one on looking at how to sort of encourage behaviour change when you're changing prescribing, one on anthelmintic resistance. There'll probably be one on young stock, and we've got some other topics as well that we're hoping to cover with the vets. So the whole point of it is to have these highly trained vets and to get them to implement a new responsible prescribing plan for their practice in 2021. So every practice that's involved in this will be making some sort of change to their antibiotic prescribing from January 2021. What we didn't want to do was to just say you'll all be doing this one thing and this one size fits all change, because we know that different practices have different clients who have different needs and they're doing different things already. So we wanted each vet to design their own plan based on the needs of their practice and their clients. So some practices might be starting to do medicine audits once a year on farm, where they come out and work out what medicines you've been using, have a look in the medicine cupboard, work out whether we can improve on what's being used, and just trying to sort of audit what's going on. Some practices might look towards benchmarking farms and their use. Some practices might look more at the client evenings and sort of knowledge exchange kind of work. And some practices might think that staff training is the way forward. We won't know what the practice is designed until we run that workshop, but it's really open and up to each practice. So what I would ask you is to please support your practice in making these changes, because it's a really positive thing for Wales to be leading on responsible antimicrobial use, and for Brand Wales and for us as an industry, as the farming industry, it's fantastic to show that these initiatives are working. So when your practice maybe announces that they're going to be making some changes in prescribing in January, please support them. They're working really hard at it, and there's going to be really evidence-based change. And yeah, next time you see a vet, ask who the champion is at the practice and what it is that they will be changing, because they'll be very happy to talk to you about it. So we know that there are a lot of challenges involved with reducing antibiotic use, perhaps, or improving responsible use, but there are loads of opportunities as well. So some of the challenges that have been coming up, vets are concerned perhaps about some lost profits or lost clients. They're concerned about other practices perhaps trying to undercut on prices, and they're very concerned about illegal imports of prescription medicines as well. Another challenge is this concept of embedded cultures. So it's really hard to change something that you've always done. If you've always prescribed pen and strep for a certain condition, it's really hard to change that behaviour, and that's a bit of a challenge as well. And the prescribing champion's not always the boss, so they've maybe got to convince people within the practice as well as outside of the practice. But the opportunities, this is a truly unique national network of highly trained vets. Yeah, it's completely world leading. It's not been done before. The wonderful thing about it is that since I started this project, I've had the Chief Veterinary Officer of England and of Scotland basically on the phone saying, what are Wales doing? This looks fantastic and we really want to copy it. So they are now looking at us in Wales to see how this goes, because they want to copy it. They think that what we're doing is really, really fantastic. And I think, you know, for quite a small country, we're making a really, really big positive change here, and that's something to be really proud of. And there's so much potential to do so much more with this. So yeah, I just wanted you to be aware of what we're doing, and I would ask you to be really supportive of your practice if they're involved in this. Speak to them about it, because they will be open to letting you know what it is that the changes that they might want to make, and they want to make changes based on what their clients need. So let them know what it is that you would like to see. Thank you.
Grêt, felly os oes gennych chi unrhyw gwestiynau i Dr Gwen Rhys, fel o'n i'n deud, ydy ddim efo ni heno'n anffodus, ond mae croeso chi ar un o fewn wrth wasgu'r Q&A, bottom Q&A. So if you have got any questions for Dr Gwen Rhys, who unfortunately couldn't be with us this evening, please press your Q&A button and type them in, and we can get them answered for you and send a reply as soon as possible. Felly nesa, mae gennym ni Joe Angel o Wern Vet. So next up, we've got Joe Angel from Wern Vets, who will be covering the flock health planning element and reducing use of antibiotics. So I'll hand you over to Joe. Diolch yn fawr.
Right, well, thank you very much. I'm just hoping you can hear me correctly. Lisa, if you can just say if I am.
Yeah,
excellent.
We can hear you, yeah.
Right, well, thank you for having me, and thank you for turning out this evening to listen. I'm going to talk to you about health planning in sheep, and there will be a focus within this on responsible use of antibiotics and in trying to reduce antibiotic use in sheep flocks particularly. I'm being used by Farming Connect at the moment on one of their demonstration farms through EdDog, and I will just touch briefly on what they've been doing in some of the areas. The project we're doing out through EdDog at the moment is actually on cattle fertility rather than on sheep health, but I've worked with them on their sheep health for some years, so I do know something about that for them as well. So I'm a vet at Wern Veterinary Surgeons, and I have an particular interest in sheep, and spend much of my time working on that. And I'm really keen on health planning when it works well. I know there'll be quite a few people listening who may have had experiences of health planning where it's felt like a waste of time or not achieved what they hoped it would achieve. But I'm hoping today I can present a different picture that might inspire you to have another go, and some of the things that could be gained from health planning. And I would encourage you, if that is something you want to do, as you go and speak to your vet and engage them and figure out a helpful way forward. Yeah, I know there may be size with regard to health planning, but I'm hopeful that we can come up with some reasons to be cheerful about it as we move on. Certainly I've had experience where people have viewed it as bureaucracy or just another hoop to jump through, you know, with a sort of never-ending amount of paperwork. I've certainly been asked to do health plans for people so that they can be registered in order to receive payments for things, and I know that that document is going to do nothing other than sit in a drawer until next time. But I'm hopeful that as off the back of this talk, there'll be some examples where that it could be more useful for you moving forward. So my view of health planning is that it should be used to help increase productivity on a farm. We should be trying to, if we've got healthy animals, they should produce better than unhealthy ones, and that for me has got to be a primary focus. And alongside that, if we've got healthy animals, we've got better welfare. And as a vet, you know, I have that in mind at all times. But I know, you know, these are production animals, so we want to have animals that can produce. And for me, if we can sort of get this nice mix between trying to improve health and increase productivity and improve efficiency, then for me that is a job well done, and what we should be striving for through health planning. That would be a more sort of generalistic view of thinking about health planning. I think it's also useful to view it in trying to solve specific problem, and you may want to consult your vet to address a specific problem on the farm. Let's take lameness as an example, something I have a particular interest in, and you may think, right, I've got lame sheep, and I think I could have less lame sheep on this farm, and I know that if I have less sheep, then they're likely to perform better, and I will spend less time having to deal with lame sheep. And so I would hope that your vet would be able to work with you to help you reduce lameness, so that you're spending less time dealing with lame sheep and you have a more productive flock at the end of it. And as Lisa mentioned in the opening slides, really, this would be a good opportunity to see if you're eligible for an animal health clinic, which might help you start that process and pay for some of that investigation and health planning process at the beginning. So certainly it can be used more generally or with a problem focus. It can be done in a sort of annual review basis, or can be a more active process, and I think both are helpful. And I work with farms where they make more out of one or other of these approaches. So I think an annual review process can be helpful in that it gives you an opportunity to look back over the year, to consider what went well over the year and what can be sort of brought forward from those things that went well to be re-implemented in following years, but also what went wrong or what could have been done better. So maybe an abortion problem occurred, and I certainly have experience of this, where I might be consulted to deal with an abortion outbreak at the time, and then when we come to the annual review process, that might occur in the summer, let's say, to review the health plan, and it can be helpful to look back and go, okay, what happened in this abortion process? What did we find out? And what were those interventions we planned to do? Did we decide actually we diagnosed a disease for which there is a vaccine, so why don't we remember to use that vaccine? I've certainly been to farms where we've had the same abortion problem year on year, and I don't necessarily think that is sort of willful. It's more just that we've forgotten what we planned to do. But this annual review process can mean we take stock and say, okay, let's put some events in the diary that we're going to do. We're going to give this vaccine then, and we're going to use it like this in order to try and prevent a similar problem happening again, and end up with a more productive and healthier flock at the end of it. I think also it can be useful as an active process, and I know some farmers find it more useful to have a sort of mini review more regularly than once a year, and maybe to look back over the last quarter of the year and say, okay, well, how did lambing go? And we'll now look up toward weaning, or we've just weaned the ewes. How are we going to make sure all the lambs are finished well? And let's plan the health of the ewes forward up to tapping. And let's think about the year as it is. How's the grass doing? And how have we coped with parasites at this point? And to bring in lots of different things together to try and make an active plan for the next part of the production cycle. I think as farmers, you've got a lot on. There's a lot to think about and remember. And, animal health is just one part of that. So do make use of your vet or consultant in order to get the best out of the animals that you have, and to have the most efficient and productive business that you can. This active process could be problem focused. So considering the abortion situation, it could just be focused around one particular problem and trying to drill down into that, find out what's going on, and making a plan so that it doesn't happen again. Or it could be more prevention focused, looking at wormer use well before the lambs are even born. So we can say, okay, well, how are we going to get these lambs to grow well? How are we going to minimize wormer use whilst maintaining growth and productivity to a maximum? And how can that best be achieved? And I think both are useful and have their place. And you may find one or other approach more akin to your style than another. Certainly, I find where this works best from my perspective as the advisor is where this relationship has developed over time. The flocks that I've worked with for some time, I can give much better advice to, because I can remember what happened in previous years, where things have worked and where they haven't worked, and why that might or might not be. And certainly the farmers where they present the worst case scenario to me, I think we get better results in that we can really deal with a situation for what it is. I find it really satisfying fixing problems, and that was one of the reasons I became a vet, was I wanted to go out and fix stuff. And so for me, if I can get this real synergism between improving health and welfare and productivity and reducing costs, then if I can achieve all that in one go, I find that a really satisfying outcome. So I do benefit from this as a vet, but hopefully the benefits for you are obvious in terms of having healthier animals and a more productive flock, and hopefully improved margins as a result of that. So I think there should be mutual satisfaction in this process if it's done well. So I'm just going to come on to thinking about how health planning might be useful in looking at antibiotic use, and particularly in light of the this push to try and reduce the amount of antibiotics used on farms. Some of you may have come across this through, if you're members of FAWL, Farm Assured Welsh Livestock, if you're members of that, they've made it compulsory to have an annual health and welfare review. And this has been particularly to look back over the year and say, okay, what have we done? And there's specifically a medicines review part of this, where we look at the amount of medicines that have been prescribed and used over a year, and use those to highlight problems on a farm that might be happening, and hopefully providing the farmer with advice and strategies to reduce that problem, and at the same time reduce the amount of antibiotics used. So I found these really useful for farmers in saying, okay, we're using a lot of antibiotics here of this time. Let's talk about that. What's going on? Is there something else we can do? Is there a better strategy for controlling this problem? And you know, if it's pneumonia in calves, is there something we can do to the shed to improve ventilation, or have we found out what are the causes of pneumonia in these calves, and are there more cost-effective ways of preventing the disease with a vaccine rather than trying to control it after it's done its damage with an antibiotic? So hopefully, if these things are done well, that it shouldn't be particularly onerous. It should actually be beneficial to your farm and hopefully improve productivity, save money, and improve the health and welfare of the animals. So why this big push on antimicrobials or antibiotics? What I wanted to stress really is that these medicines are used to treat bacterial disease specifically. That's what they're designed for. So antibiotics are medicines that treat bacterial disease. So some examples of bacteria or diseases in sheep caused by bacteria would be foot rot. Some types of pneumonia are caused by bacteria, others caused by viruses or fungi or other causes. Joint ill would be another example of a bacterial disease, and these are all different types of bacteria. And if we've got an animal that is sick with a bacterial disease, then it needs an antibiotic to treat it. However, if we use antibiotics wrongly, if we use the wrong one, or we use too little of an antibiotic, or we use it in the wrong way, there's lots of ways to use an antibiotic in a bad way, then bacterial resistance can develop. And what this means is then the antibiotics stop working. So when we use an antibiotic in the wrong way, the bacteria can evolve to then not be susceptible to that antibiotic, and so they can then survive rather than be killed by the antibiotic. And this is a problem not just in sheep, this is a problem across the world, and it's of particular concern to the global community, because there are a growing number of diseases and situations in human medicine where antibiotics are no longer effective. And I'm sure you've read and heard all about this before, but this is the drive that's coming into farm animal practice now is coming from this direction. So some of the bacteria found in animals can also end up in humans, and if those bacteria have developed resistance as a result of irresponsible antibiotic use, then that can lead to a problem in a human where it can't be treated anymore, and that could lead to serious injury or death. So it's a serious problem, and that's where we've all got to play a part to deal with it. So as I've said, really, the reduction, if we just use less antibiotics overall, the less times we use an antibiotic, the less chances bacteria have got in developing resistance to it. But this really needs to be balanced against managing animal welfare and in particular treating bacterial disease. So I know some farmers have come to me at these medicine reviews and said, you're going to ban us from using all antibiotics. And it's, I really want to stress that that is not the case. And no one is more concerned about animal welfare than your vet. But we need to balance that against using antibiotics in a way that's going to lead to this growing problem of antibiotic resistance. So I have stressed throughout this really that antibiotics are useful for treating bacterial disease. And one of the real ways we want to try and improve things in sheep medicine is to get away from using them as a prevention, because they're not very effective at doing that. And when we use an antibiotic to try and prevent the possibility of disease, we end up treating a lot of healthy animals and exposing a lot of animals with a lot of other bacteria to an antibiotic unnecessarily. And this is one of the ways that antibiotic resistance can develop. So the Sheep Veterinary Society have come up with 3 areas where antibiotics are used quite a lot in the sheep industry, and so these are the areas we can make the biggest gains in reducing use. So the first one I want to just briefly mention, and we can go into these in a lot more depth if you want, but just briefly, really, the first one I want to mention is the practice of using antibiotics to try and prevent enzootic abortion. So this is no longer recommended as a way to control this type of abortion. I must stress there are other types of abortion. I'm particularly talking about one type of abortion, which is very common. Historically, people would have used antibiotics close to lambing to try and prevent cases of this abortion. Unfortunately, that didn't work that well, and in doing so, giving antibiotics to all the lambing ewes would mean that lots of other bacteria are getting exposed to the antibiotic and possibly leading to resistant strains with concurrent problems in the future. I know there's been confusions in some areas where people have confused antibiotics with vaccines, but they are different types of medicine. So as I said, an antibiotic treats a disease and a vaccine prevents a disease, but it is not an antibiotic. So it tricks the immune system to thinking, into making defenses against the disease, whereas an antibiotic comes after the disease is already present to try and treat it at that point. So for enzootic abortion, there now are, and have been for some time, effective vaccines which need to be given to the ewes before they're pregnant for them to be effective. And this tends to be a much more cost-effective way of managing disease, but also has the added benefit of not relying on an antibiotic to try and damp down an abortion situation. So that's the first area where if you're still using antibiotics in this way, I'd urge you to speak to your vet to try and find an alternative way to control this type of abortion in your flock. The second big area where we can make big inroads into reducing antibiotic use is in lameness. This is an area close to my heart, something I've worked on a lot, and I know it's an area at the demonstration farm through Ed Dog, where they've made big inroads into reducing antibiotic use by having an overall look at lameness and putting together a health plan to try and address that effectively, looking at different strategies to control lameness, and in so doing reducing antibiotic use overall. Now, as I've put on the slide there, most of the causes of lameness, the vast majority of causes of lameness in sheep are by a bacterial infection in the foot. So the majority of lameness would be caused by foot rot or cod, or a combination of the two. Both of those, there's a picture at the top is foot rot, the picture at the bottom is of a cod lesion. And both of those diseases are caused by a bacteria. And so if there is a sheep with foot rot or cod, then you are strongly recommended to use an antibiotic to treat that disease. And part of the 5-point plan for controlling lameness, the main point of that plan is to do prompt treatment with an antibiotic to treat these sheep with these bacterial foot diseases. In so doing, the recommendation of an antibiotic there, if it's used correctly and promptly, in so doing, you'll not only make that sheep better and help her produce more, but you'll stop her spreading that infection to another 4, 5, 6 sheep, and so resulting in even more sheep needing treating with antibiotics. So prompt treatment on farms not only reduces lameness overall, but also reduces antibiotic use overall. So if none of this makes sense, you don't know what I'm talking about, then please talk to your vet and get a plan in place to manage foot rot and cod on your farm down to a low level. With these diseases, it's often important to use the right antibiotic. One of the reasons that cod was first identified as a new disease was because people were using an antibiotic that had been recommended for foot rot and it didn't work very well for cod. So we now recommend different antibiotics for different types of foot disease, and it's important you're using the right one. This again comes under responsible antibiotic use, and in using the right one, you'll use fewer treatments, and in so doing, overall use less antibiotics in the end. The other thing I wanted to mention here again was whole flock treatment, or treating large groups of sheep as a prevention for lameness. I carried out a study for this as part of my PhD, and we showed that this strategy doesn't work. It's expensive, it doesn't work well enough. In the flocks where this was tried, often the disease came back later on. In doing this approach, you expose a lot of sheep, a lot of healthy sheep, to an antibiotic, and with all the potential consequences for developing resistance in various bacteria later on. And then the final focus on for lameness is the use of antibiotics in foot baths. I know historically in the past, people will have recommended using antibiotics in foot baths to help control some of these diseases, but this is no longer acceptable. There's no antibiotic product licensed to go in a foot bath. They've often been a poultry antibiotic. So we don't actually know what concentration they should go at in the foot bath. These antibiotics are often deactivated or damaged, so they're not as effective when muck and debris ends up in the foot bath. So I think we're often using them if they're used in this way, they would be used at a strength that isn't effective. And then you have to think what happens to the foot bath when you're finished. It gets turned over onto the ground. This sublethal dose of antibiotic goes into the soil to affect millions of other bacteria within the soil, which then could potentially end up in the food chain as well, with all sort of unknown resistance possibilities there. So this again is not a suitable way of managing lameness. And I would point you to the 5-point plan, where there are effective strategy, which is an effective strategy for controlling lameness on most farms. And it would be worth your while spending some time figuring out how to implement parts of that in conjunction with your vet or consultant to help this problem on your farm. And then finally, the last major area where I think we can make big inroads into reducing antibiotic use would be in managing the diseases of newborn lambs, particularly things like watery mouth, joint-ill, scours, but there would be many other bacterial diseases we would see in lambs at this point. Now, just to reiterate, if you've got a lamb with one of these diseases, watery mouth disease or with joint-ill, for example, then I would strongly recommend you using an antibiotic to treat those individual animals. What we're trying to do is reduce the use of antibiotics as a prevention strategy. So historically, there would have been strong recommendations where disease had occurred on a farm to go in early with an antibiotic and give all lambs a dose of antibiotic at birth. But actually this, again, just exposes lots of bacteria to an antibiotic unnecessarily, and resistance can develop. We carried out a survey on some of our farms a few years ago, and we found that about a quarter of the lambs surveyed had within them bacteria that were resistant to antibiotics commonly used on sheep farms. And in some farms there was so many antibiotics they were resistant to, we were finding it really hard to find any antibiotics that could work in their lambs. So this is, if you don't think you've got a problem, you probably have somewhere, but it may not be known yet. But I think, I've talked to farmers about how to address this problem and strategies they could do to try and reduce their use. And I know farmers have been frightened about stopping antibiotic use in some cases, in case death or outbreaks of disease occur. And what I would stress here is work with your vet well in advance of tupping time, really, but well in advance of lambing, in order to make a health plan that will actually deliver a result on your farm, which will actually give you the strategies to try and prevent this disease from happening without using antibiotics. If disease occurs, you've got antibiotics as a backup, but that's what they should be, as a backup. And I think when we're using antibiotics in this way, they should be there telling us when we have to use them, there's a problem here that we haven't prevented, and now we're having to use antibiotics. So what could we do differently next time to try and avoid this situation in the future? Often there isn't a one-size-fits-all strategy for all farms, and so that's why I think it's really important you start working with someone in order to tailor the approach to your farm. Sometimes records will be useful. I know a lot of farms won't keep health or disease records, but some amount of records, even very minimal, can be really useful in helping us spot trends and working out whether things are working. Have things got better or worse or stayed the same? Literally just keeping all the antibiotics that you've used on a farm can be useful for year to year, just in a big bin. And if the bin gets smaller, you know things are working because you're using less. You know, some sort of recording system can be helpful in order to work out whether a management strategy is helping. So just in summary, we've had a very whistle-stop tour through health planning, and there's lots that could be said on all these areas. We could talk for hours and hours on just one of those areas, but I just really wanted to provide a sort of positive overview of where health planning could be helpful to your farm, and hopefully taking something away that could help. I really think we should be focusing on improving health and welfare and productivity, as well as trying to reduce costs. I think if we having to use antibiotics a lot for a certain type of thing, I think that should alert us to thinking, okay, is there a problem here we could be addressing differently? Is this telling us that we're actually not managing this situation very well, and there are other strategies we could use to try and prevent this? We've got to try and reduce antibiotics across all sectors, but at the same time maintaining and improving animal welfare. And finally, if it's possible, try and keep some records, as this will help your advisor work with you to try and improve things. Thank you very much.
Great, thank you very much for that informative presentation, Joe. We've got quite a few questions that have come in, so mindful of time, if you're happy, Joe, we'll go straight into those questions for you. So first of all, we've got one question here. We buy in beef calves at about 4 to 6 weeks of age. A vet once told us that we could or should give them all an injection of antibiotics on arrival due to the stress of the journey and changing habitat, reducing the immune system. For the last few years, I've not done this because it seems a bit antibiotic heavy. However, I think I'm using more antibiotics on some of the calves within the first 10 days, if and when they do go off colour. Should I inject them as a preventative, or should I carry on treating only those who show signs of ill health, even if they need 2 or 3 injections and they do vaccinate intranasally for pneumonia?
Wow, well, that's a good, very detailed question. I think it would be worth trying to find out exactly what the causes of the problem are on your farm. So a bit of investigation might go somewhere. Sometimes the vaccine you've been using, sometimes there's a better vaccine to use, so it might be worth exploring that. Sometimes if it's pneumonia, there can be sort of quite small or relatively cheap changes that can be made to buildings or the way that the carbs are managed so that you can improve health. I think you're right. I think you've done a good thing. You've said, oh, I want to try and stop antibiotic use, but then a problem, you feel the problem's delayed or got a bit worse, then I think have another think, and perhaps some investigation might be useful in trying to fix that problem. So I'm not going to give you a direct answer to that at this stage, because I think we need to know a bit more to be able to deal with that.
Thanks, Joe. So the next question, we have foot vax. We have foot vax and still suffer a lot of problems with foot rot. What would be the best antibiotic to help foot rot? We isolate the problem sheep from others, but are still struggling to clear it up. We have some cases of cod too. Which is the best way to cure?
Okay, so most antibiotics will work against the Dichelobacter nodosus, which causes foot rot. I would check your diagnosis each time. I know with a lot of farms I work with, often I'm looking at a foot and I'm thinking, is it foot rot, is it cod, or is it a bit of both? If there's cod present, then I think you want to be using a long-acting amoxicillin injection instead of an oxytetracycline. So a lot of people would use an oxytetracycline type injection for foot rot, but I think there's a lot of evidence to say that, or some evidence to say that you might be better using a long-acting amoxicillin injection when you've got cod present, and that will actually work against cod and foot rot. However, it's usually more expensive than oxytetracycline, so there is a balance to be struck between getting the diagnosis right and then using the right medicine for the right the right lesion. And it'd be worth speaking with your vet if you're not quite sure about diagnosis, to get some good images so that you can sort of try and differentiate between the two diseases to get the right one there. I would also say have a look at the way you're using the antibiotic. A lot of the studies that have looked at the treatment of lame sheep with oxytetracycline or amoxicillin injection have shown that not all sheep get better off one injection, and so they may need a course of injections given an appropriate interval. A lot of oxytetracycline long-acting injections can be given every 3 days, amoxicillin long-acting usually every 2. So you need to know about the antibiotic you're using to use the correct dose and then at the right interval in order to get a cure. So a lot of studies have shown that you won't get 100% cure off all sheep from one injection, and you need to know which ones you've treated and which ones have got better and when, in order to make sure that you get the most out of the antibiotic you're using. I think in that situation, if you use an antibiotic, you inject a sheep today and then you think, oh, I'll check her in a couple of weeks and she's not better, what's happened there is you've started treating the disease and the antibiotic has got up to a high concentration in the sheep, and then it's drifted off and the bacteria have been damped down a bit at the beginning and then they've come back up again afterwards. And it may be that during that process, the bacteria get harder to treat. So it is important to sort of check sheep at the right interval in order to get good cure rates from your antibiotics with lameness.
Great, thank you, Joe. Another question here on jointil this time. I've heard that there is work being done for a jointil vaccine. Is this true? And if so, how far away is it from being commercially available?
Yeah, there is work being done for a jointil vaccine. I'm not doing it, so I don't know how far off it is from being commercially available. These things always take time, and it is a vaccine we're desperate for as the industry. So you have my sympathies if jointil is an issue there. I know it's being trialed. I haven't seen the data. I don't think that's out yet. So it's in that process of being trialed and worked on, but it's not yet commercially available as far as I'm aware.
Okay, thank you, Joe. It says on the enzotoxo vaccine packaging that the vaccine, I've lost that question. Hang on, bear with me. Sorry. It says on the endotoxo vaccine packaging that the vaccine should be repeated every 2 years. Do I need to vaccinate the same ewes again if they were done as ewe lambs prior to tupping?
I think you need to work that out. I don't know your flock, so I think you need to work that out with your vet or advisor. It may be that the vaccine lasts longer than the 2 years. When you speak to the drug company, that the studies have been done for that long, so they can provide a reliable statement on the data sheet. You may know farmers where they don't do that with success. Now, that we don't know whether that is because it's lasted longer or whether they've got away with it. So I think there may be situations where you do vaccinate and maybe situations where you don't vaccinate, but I think you need to have that conversation with the prescribing vet in order to work out the best strategy for your farm. There's only a small amount of information on data sheets. That which is there is reliable, but often there's more information available. And when the advisor really knows your farm situation, they can make better judgments for you.
Thank you for that. And I'll squeeze this last question in. Are you aware of any new technology that can help manage and reduce lameness? There are pedometer type tech available for cattle, but not aware of any similar cost-effective options for sheep.
I think that is the issue. You've hit the nail on the head, cost effective. So there is technology that's been used, sort of pedometer type technology that's been used in research in sheep, and also interestingly, where they've used cameras to look at facial expressions of sheep. You wouldn't imagine that they have different facial expressions when they're lame, but they do. But all those technologies have been used in a research context and are not yet commercially available. And I think that is part of the issue, is that actually margins in sheep production aren't huge. And so new technologies need to be really cheap in order for that to be effective. But what I would say is something that is really cheap is a pen and a notebook, and just keeping an eye out once a week for lame sheep has been shown as a really cost-effective way to reducing lameness. If you just choose to look for them, then you will do something about it. And that at the moment doesn't cost anything.
Great. I did say that was the last question, but we've just had an anonymous one in, and I just thought we just get this one in. Sorry, Joe.
Right.
What would you recommend to help protect lambs against ticks? We struggle with lambs being covered in ticks by the time they come in for their first Clostridial jab at about 3 to 4 weeks, and we lamb outdoors.
Yeah. Again, there are several products available for ticks, and I'm not allowed to say one or another without knowing your farm. So you need to talk to your vet about that, who actually knows your farm situation, or explain to them your farm situation in detail, how the land is set out when the sheep go to different tick habitat or other. And ticks are a growing problem in our country, and I am seeing more tick-borne disease, so you have my sympathies. But yeah, I can't recommend something specifically at this point, but there are a few products available that could be useful.
Great, thank you very much, Joe. So yeah, thank you very much for all of you for listening. Thank you for our speakers this evening, Joe Angel, and also Felly diolch yn fawr iawn i chi gyd am wrando.